panelist things, and then we're going to get moving here. Welcome everyone to our DOS and CASE webinar discussing reopening of community programs. Let's start just jumping right in. We're still trying to find one panelist who may be out there. Patty, there's a panelist link if you want to try to enter through that. Sarah had sent that out via email again this morning. Anyways, welcome and introductions. I'm going to go first since I'm already talking. I'm Mike Zog. I am Program Director with Office of Community Partnerships, joined by a couple of folks here today who will be part of this event. Why don't I kick it over to Fiona to say hello?
Sure. Fiona Hindy, co-chair of Coalition of Agencies Serving the Elderly, and we are thrilled to be able to put this on with in collaboration with the Office of Community Partnerships and DOS. Dan, you want to?
Yeah, I think I'll go next. Hello, everyone. I'm Dan Gallagher. I am the other co-chair of CASE, and just to remind people that CASE is the Coalition of Agencies Serving the Elderly. So we have, this coalition actually represents roughly 40 organizations that provide services for seniors and adults with disabilities throughout San Francisco. And I just want to mention, I want to thank Mike and Fiona and our panelists today, Francesca Gonzalez and Toby Schwartz and Patty Clement, for all their work in developing this webinar and the presentation and the information that you're going to receive. And just a caveat here, and I'm sure Michael mentioned this as well, even as we started this process some 5 or 6 weeks ago, and gathering information and accordingly developing the presentation, things change as we speak. And so we know right now that we have a Delta variant in our midst that that may change some of this guidance. So that can be part of the discussion today. I just want to mention that, Mike, ahead of time.
Yeah.
And we'll go from there. So thank you all for attending.
Let's go for Toby.
Sure. Hey, I am Toby Schwartz, the Senior Center Director at Curry Senior Center in the Tenderloin. And I'll talk a little bit today about how we've been navigating the fun last many months.
And good afternoon or good morning still, everyone. I'm Francesca Gonzalez. I'm the Director of Senior Programs for Day Services at Unlock Inc.
And then we have another mystery Mike Zog over there, which I think is actually Patty, who has joined us, and we'll have to update her name thing on there. Patty, are you out there?
Apparently I am the mystery Mike Zog.
Boy, I'm having existential crisis issues over here. Are there multiples of me? What's going on?
So hi, everybody. Patty Clement. I am with Catholic Charities. I am a Director of Client Services, and I oversee our aging support services and our child youth development programs. And I will be assisting with this presentation and helping do the open discussion part.
Okay, cool. Yeah, so thank you guys so much for joining us. I think, Dan, you alluded to kind of the process of putting this together. And I think we had some great conversations along the way. And let's see if we're able to recreate them in this public format. And just also, I mean, I think CASE is pretty well known through the community, if not totally well known, but I just want to sort of highlight the role that you guys have played in representing the community and working with DOS for really many years at this point. And just for folks out there who are not engaged with CASE or had questions about it, to really reach out to you guys and get involved. I think you guys have done a lot of important work to support not just sort of organizational capacity and development, but also, you know, pushing forward how we think about and serve older adults and adults with disabilities in the community. So cool. Just quickly looking at our agenda. I'm going to talk for a bit, then we're going to have Francesca and Toby talk about what's going on with their reopening plans. We'll have some time to open it up to the group. Patty will speak sort of on behalf of CASE, and we'll kind of discuss where we're at and what we're going through. And then at the end, I think we want to really open this up to hear from the folks participating. And I think that I have sort of we'll have sort of two prompts that we'll try to get as many people to kind of weigh in on as possible. And that is, what is the biggest challenge for your agency's reopening? And maybe what is the best practice or other step you have already taken in your reopening process? Okay. What are we going to try to accomplish today? I'm going to talk quickly about relevant guidance and resources. I'm going to talk about kind of where DOS is with all of this and our expectations and how we're thinking about the reopening of services. We'll hear from the panelists. We'll talk about how the challenges we're facing, how DOS guidance and how agency plans are going to interact with one another. But I think one of the things that we also want to take out of this is better understand from folks in attendance how we can support that reopening process, gaps in support and guidance that are needed, and beginning to firm up, kind of as we move forward, what the new normal is going to look like. Kind of housekeeping items for today. The intended audience out there really is program and operational leadership who are developing and implementing these reopening practices. I think there are many different programs and shapes and sizes of programs throughout our network of services here in the city. I think what we want to kind of do sort of generally is focus on the idea of community centers that are inclusive of programs within them, speaking broadly in that sense. And we will not really get too far into more specialized, particularly licensed programs, such as adult day or residential care facility programs. Those, of course, have very strict or much more strict guidance and regulation tied to them that really this is probably not the audience for that. If there was a need for that, we could consider that through a different format. We are going to record today's event. I think the announcement has already gone out so that we can post this for later viewing for those who were unable to attend today. And the slides will actually be posted for download as well. We'll also email them out to registered participants. Closed captioning is available and appears to be on, for me at least. So if that's not already on, it is in the Zoom functionality to turn on. Questions and feedback. So what we're going to do is we're going to use the Q&A function initially in Zoom where people can post questions. We are going to try to answer questions. I have at the end of each topic area, I think I'm going to talk and then have Toby and Francesca talk and then maybe start with questions in that period. But we'll start with Q&A. We'll open up the chat function when we reach the larger discussion, primarily as just another outlet for people to communicate with us in the event that Q&A or the hand raising function isn't really working or what have you. Okay, so we're going to jump into what I am going to be talking about today, starting with the current guidelines that are out there to help guide community programs in reopening. There are just a couple of them. There are primarily the state of California's Beyond the Blueprint guidelines. There's the Department of Public Health's Safer Return Together Health Order, which is a local order. We've got the Cal OSHA COVID-19 Emergency Temporary Standards. I think that many people are already aware of these, and my presentation has crashed. Okay, let's see. See if I can get this thing up and running again. Bear with me, folks. So I was alluding to those main three guidances. I am not going to go too far into them because I think that they are readily accessible via Google search, or I can share a link. I think many have seen them at this point. Okay. Aha, and hopefully we're back. Panelists, does it look good?
Yeah.
Okay, good. All right. I think, I think perhaps one of the, I think people are aware of these guidelines and have seen them. Perhaps one of the larger challenges that people are experiencing is the lack of guidance. These are very broad instructions. These instructions are not particularly targeted to community service providers. That has been a challenge throughout the pandemic. Really just our ability to get guidance specifically for our service group has been a problem. I think that that is in part because there are so many entities out there and public health departments and such have just had to strategize and prioritize about who they are going to provide guidance to. I think we've even seen through the COVID pandemic, our executive director and our deputy director both deployed to our COVID pandemic response, in part in attempts to make sure that there is a place that our programs are considered and guidance and is accounted for, we are accounted for in guidances and things like that. Anyways, the lack of guidance, and I think perhaps the idea that, when we had gotten so used to restrictions growing, now with them being released, there are actually very few restrictions in place. I think that is creating a challenge for folks. I just want to note the additional requirements based on licensure for some specific programs. This includes adult day health, adult day, residential care facilities. I know that there are some of those programs in the audience today. You likely already know that your licensing agency has additional requirements. As a general matter, community centers and sort of related more typical DOS and OCP funded programs do not have that level of requirement on them or a licensing agency. I want to note that things have changed even in the past few days. We have seen, in particular, one that I wanted to highlight was yesterday, a joint statement issued by San Francisco, Santa Clara, and Contra Costa counties in union, urging businesses to require vaccination among staff. There's a theme that we'll thread through this. I'll mention is that all are in agreement at the public health level that vaccination is the best way to address the pandemic and end the pandemic. And vaccination of staff is one of the best strategies that can be done. That joint statement I can share out. It is pretty readily available through a Google search. I would note that it includes links to information from the California Department of Fair Employment and Housing, which kind of lays out the justification that allows for employers to institute vaccination requirements for their staff. We saw also, we've seen, some softening of masks moving back, actually maybe perhaps hardening, I guess, moving back towards masks are again recommended indoors for both vaccinated and unvaccinated, or unvaccinated and vaccinated folks at this point. So we've seen things shift in that direction just in the past few days. There's also been some news about the city mulling a requirement for businesses to check patrons for vaccination status in order to access services. I think the thinking along the lines is that we've seen that happen in France. There is no decision on that at this point. That is just per the news, something that is being tossed around within the city. I don't have any sort of insight or guidance as to whether that will be a thing. Okay, just wanted to, at this time, just quick pitch on sf.gov. They do have a COVID outreach toolkit, which has lots of good informational flyers and other sheets that are downloadable and can be used and posted if that is helpful to organizations. I have just kind of a couple examples here about masking and encouraging vaccination, one about ventilation and its importance and how a site might be implementing ventilation practices. That is just a sample of many on there. I stashed the link there as well for folks to use. If printing of signs is a barrier for anyone, do reach out to the department. I have my contact info at the end, and that is something we can help work around with you guys. Okay, so I want to start with what are we even doing for city employees, and use that to kind of build out from there. And I think it's been in the news, so many people sort of know, but that all city employees must disclose. We have to disclose to our Human Resources Department. I put by the end of July, I think it's actually July 29th, our vaccination status one way or the other. We do have to show, if we are vaccinated, we do have to show proof of vaccination by showing our card or something similar. All city employees are required to become vaccinated. Generally that is, and demonstrate the status, generally that is within 10 weeks of the FDA regular approval of vaccine. Again, we're still in sort of emergency approval. I have not heard when that regular approval is going to take place. I also wanted to note that there's a carve out for those working in high risk settings that vaccination completion is actually required sooner than the regular approval. High risk settings, for those interested, is defined in our current local health order. It's generally including hospitals, skilled nursing facilities, jails, shelters, and residential care facilities. As I note, employees who have not verified their status as vaccinated must wear masks in our workplace. There has, of course, in the last couple of days been the additional modification that it is now, recommended, even strongly recommended for that those who are vaccinated and don't need to wear a mask, it's still recommended for them. So what does that mean? So I am vaccinated. I have submitted my information to our HR department. They have said, Mike, you are vaccinated. And they have sent me a nice note saying that when I am on the premises, I do not need to wear a mask because I am vaccinated. But I have seen the news and I am thinking, this is okay, all right. What about me? What about my loved ones? What about the people around me? So when I'm in the office, I am going to be wearing a mask for recommendation. What are we doing? And then speaking of that, how often, when am I in the office? Am I in the office right now? We are working back towards that. I think that, I don't know how many city services actually stopped. I think most city services kept going in sort of modified format. we are moving more and more back towards previous formats, with including workers in office. I think we are talking about having that really in place by September 1. We are returning to the office with no social distancing or restricted capacities. Okay. All right. So that's what we're doing. What do we expect of our DOS contractors and community partners? Well, first, following the local and state guidelines is a great, that's always a place to start. We are happy to help connect you to that. If you reach out, certainly if you are a DOS contractor, you have a program analyst that you can confer with to get links or other sort of directioning on where that guidance exists. We have a limited ability to interpret guidance, but we will do our best to help get you that, get you with someone who can best provide you that interpretation. We are looking at, as we move forward, we're looking at having programs move to reopening to client access and program services at pre-COVID business hours. And I think this stems from the idea that our network of community providers and services, we reach our clients by offering services in the neighborhood, by being there and by serving them in where they live in the neighborhoods. Our community centers and other sites are known access points for information, services and engagement opportunities. People know where your locations are. They know to go there. I think that's beyond even just the target populations. I think community centers as an idea are sort of known throughout our society and seen as a resource place. So we want to continue that with sites open so that when people are in need, they have these places, we have your resources available to them. I want to quickly go into congregate meals. Congregate meals, technically there was no restrictions, all restrictions on capacity and services were lifted on June 15th. And that was part of the reopening of the city and state and the dropping of the tiers and things like that. I am not aware of anyone totally reopening their congregate meal service on June 15th or 16th. In fact, I think it still catches me a little bit by surprise. And I think it's kind of one of those, suddenly all the restrictions were removed and no one got a notice saying, please, congregate meals, go for it. But we actually can go for it. So I know, and we'll get to this in a minute, I know it's more complicated than just putting out the tables and the meals and going for it. So we'll get to that in a minute. But I want to touch on the idea that, there is, at the outset of the pandemic, there was flexibility in our guidelines for congregate meals. A large share of our congregate meal programs are funded through the Older Americans Act and therefore have to follow federal and state program guidelines for delivery of services. Those were with the start of the pandemic, those were relaxed and flexibilities were introduced. And it allowed us to move to the models that we have in place now, including sort of varieties of to-go and multi-meal packs that actually were really critical in keeping people fed and keeping people supported in the community. Now, in theory, these flexibilities could be and likely will be readjusted and restricted, probably tightened back at some point. We know that the trigger point for the relaxing of those guidelines, those federal and state guidelines, was the state of California applying for a major disaster declaration They apply to FEMA for that, and that is signed off by the President of the United States. As far as I know, that is still in effect, and that major disaster declaration has not been taken out of effect. The guidance we've gotten is that when that major disaster declaration is sort of rescinded, that will start what is believed to be a 6-month process of looking at those guidances on how we deliver services. We had our sort of National Area Agency on Aging conference this week. So we were kind of able to get a feel for where things might be going. There is a general sense that things will not go all the way back to how they were pre-COVID, that we've seen the value of to-go and multi-pack meals, and that those are a really viable and important option for many clients to participate in the programs. So while we don't know, we think that guidance will be coming to put us somewhere in between what we're doing now and what we did pre-COVID. We have some time before that happens, but but it will happen at some point. So, and that will be outside of the control of the Department of Disability and Aging Services. We will advocate and we'll be in conversation as these guidelines are developed, but ultimately they will come down and we will be asked or required to follow them. So there is something out there. So I think this speaks to the idea of being proactive now and thinking about how all this works so that we are in a better position when changed requirements come to us for congregate meal services. Okay, all that, and let's get to hybrid and virtual programming. This was big. We were able to reach a lot of people. The shift, this was really one of the really impressive shifts that happened over the past year. And I think we were pretty pleasantly surprised about the uptake in virtual services and how many people were able to participate through that. We don't see that as necessarily going away. We think that virtual programming is acceptable and is as part of services provided in the community, but we're going to have to figure out how that works. I think we have to think about who have we been able to engage, who has been able to participate in virtual services, but who are we missing out? Who is missing out? Who have we lost along the way? Who are not able to access those services in that shift? I think one way to look at this is through the lens of the client and how they access services through your organizations. Is virtual programming providing an additional option for them to access the services? Is it allowing them to do more things and engage in more activities offered by your organization? We think that this means, that the in-person option for services should be available and accessible to clients. I think that while there are benefits to virtual, it too has its own, creates its own barriers. So understanding that the in-person model still should remain an option for clients. Okay. For some of our programs, so we're going to be thinking that through, better understanding how things have worked, who we've seen, who we haven't seen over the past year. We are going to develop, we have, program guidelines, particularly in areas like community services and our SF Connected programs. We have program guidelines through our program memorandum process. And we're going to work on updating those to include virtual programming and how that fits in our service offerings. That will happen with provider input along the way. Typically, our quarterly provider meetings are one venue. We also may do ad hoc committees and other things to help craft those. Fully acknowledging what I'm talking about here. There's going to be unique challenges from agency to agency and program to program and how you reopen. We totally get this. I mean, we have things like some agencies own their building, some are tenants, some are, have federal landlords that have had their own rules that are different than a private landlord. I think there's one or two congregate dining rooms out there right now that are storage for grocery programs and PPE. There are all kinds of things that need to be figured out. Staff need to be reacclimated to working in the office and going back to a new normal perhaps, and how that's going to work out for each of your organizations. We're going to be flexible in this process. We'll work with each of you to support as we can as you work through the various challenges. I mean, I think the general expectation is that things are moving towards reopening for client access. It's not expected tomorrow, but tangible plans and action should be developing and putting into place as part of this process. It can come in phases. I'm kind of teasing perhaps some of the things we're going to hear here in a moment. Sorry, guys. They were just really good ideas. It can come in phases that build to that readjustment or that restoration. And I think, as Dan alluded to at the top, with the Delta virus and the uncertainty that's bringing, reminding us, we're not out of this. I think we have to, I think the bigger picture is towards reopening with building in flexibility for adjustments and pauses based on the evolving health and safety information that we're gonna get that's evolving sort of daily, I guess, at this point. So, okay, that is it for me for right now. So I want to stop sharing and kick it over to Toby and Francesca. Let's see how I can stop sharing. Uh-oh. Aha. There we go. Okay. Toby or Francesca, we didn't decide who's first.
We did not.
All right.
Go for it, Toby.
Yeah, Toby just talked.
All right, that'll be me. Let's find this. How's that look? All right, so I'm going to talk a little bit about how Curry Senior Center has maintained on-site services and how we're working to resume them in different capacities now. Because we have been open throughout the pandemic, we have had to adapt to the quick change in public health orders that started out initially. And then looking at reopening as changes are happening a little bit slower, guidance is a little bit slower. So I kind of just wanted to give out what our initial response was, which will most likely be things that are no longer required, but maybe things that other agencies will feel more comfortable starting at, and then how we're looking at reopening at a broader level. So for employees, our initial response, it was following public health orders, masks, screening for symptoms, social distancing, and constant sanitation. We reorganized to accommodate for partial remote and partial on-site work schedules. We shifted everybody to A/B scheduling so that we could limit potential exposure, understanding that if someone was in and exposed, everyone would have to go and isolate until they could get negative results, meaning that then the other team would pick up the bulk of the remaining work. And we organized the workspaces to make sure that everyone was 6 feet apart, which was mostly possible because we only had half the staff on at any given time. We're not a big building, so if everyone had been here 6 feet apart, would have people working on the sidewalk. Some of the challenges with that was access to technology at home for remote work, or even just quality of internet in some buildings or parts of the city. And so that was something that it took a little bit longer to adjust to than I think anyone was prepared for. And then we had to move additional staff working the front door for screening of clients and staff coming in, which put people in job duties that they were not familiar with, not hired to do, but it was the only way we could manage to sort of maintain the safe entrance and exit to the building. Looking at reopening, we have increased on-site hours gradually because we want to make sure that it's not, shock to the system. And we're going by program as needed. The people that are doing services on site are maybe stepping up quicker than, for instance, development is perfectly fine continuing to work from home for now. We did retire temperature screening at the front door when that was no longer required and moved to self-screening for symptoms prior to arriving at work. So everyone is expected, if they show up at work, that means that at home, they check to make sure they weren't exhibiting any symptoms. We will follow the city process on the vaccine mandate. So when the vaccines receive regular approval, it will be expected that staff are vaccinated within 10 weeks as well, allowing for religious and health exemptions. And now, looking at reopening, we are prioritizing the Department of Public Health settings as a health center, which means that we still have a more restrictive environment than the corner store or a restaurant, and probably a lot of other community centers. So some of the challenges in looking at reopening is individual levels of comfort with returning on site. It's been a year and a half and people have to get used to the idea that it's someday we're all going to be working at work again. There is frustration with continued restrictions as people see in other settings, people are able to take their mask off and go about as they will. We are still masking on site. And there are staff that do not want to be vaccinated. So that will be something that we'll have to navigate as we get through the eventual mandate. For participants, our initial response, we reduced services to one-on-one only. So mostly meeting with case managers, getting translation work, getting social service assistants connected to whether it's CalFresh or SSI, anything like that. We started wellness calls to maintain contact with participants that were not coming on site for one-on-one work. We made online and phone appointments widely available so that clients were able to still speak with their service provider that they needed to, and they did not necessarily have to come in for that. We provided PPE to anyone that walked in the door, as well as putting it in care packages that we delivered to their homes, which expanded to include microwaves when the frozen meals were widely available when congregate dining had to reshape, and we had clients that couldn't take advantage of that, so we helped them get set up to take advantage of that. And then we started providing tablet training and helping clients and paying for clients to get home internet so that they could participate in our virtual programs. Working with older adults, you know that this is not something that is just already existing in most of their lives. So challenges, maintaining contact with participants who did not have a consistent phone number. At Curry, our population includes a lot of marginally housed or homeless individuals. And if we hope that most of them got moved into SIP hotels, but we just did lose contact with a lot. So we're just hoping to see them back again. A lot of our clients lack of access to home internet and devices, which is why we tried to get everyone connected with tablets and tablet training so they could still access at least virtual programming. And we still have a lot of apprehension about participating online. Not everyone is willing or interested in joining a Zoom program or doing, telehealth appointments. And so that's something that we have to navigate as well. For reopening, when we initially dropped into the yellow tier, we started allowing small groups on site, which helped with a lot of the participants that could not participate from home. We could throw Zoom up on the TV on the wall and then have everyone seated, masked, 6 feet apart. We have plexiglass barriers up so that they could then participate with the group at large. as both vaccinated and non-vaccinated may attend the small groups online. We do ask them individually if they are vaccinated and if they'll provide a copy of their vaccination card. If all the participants in any small group on site are fully vaccinated, then we'll offer up meals and coffee. The masks can be removed only while eating or drinking. We don't offer that if anyone attending in the group is not vaccinated. Our plan is to continue offering virtual access to programs indefinitely. We realize that we have participants who are homebound or need to be at home for a significant amount of time, and we don't want them to lose access to these things. And it's important that we have one-on-one discussions with participants about vaccination status, because there is, as I'm sure everyone's seen, a large variety of opinions and feelings about the vaccine. So when we ask someone if they're vaccinated or if we can help them get vaccinated, we try not to do that in a public setting, but one-on-one. Challenges, very much the same with staff, individual levels of comfort with returning on site. And that is both with the pandemic and racial hate crimes. So there are people that are not yet ready to return. We also, same as with staff, participant frustration with continued restrictions. Some of them feel as though being fully vaccinated, they should be able to walk in here without a mask and go about their daily business, but we can't allow that. And then the challenge, of course, designing programs that can accommodate both vaccinated and unvaccinated participants, understanding that hopefully guidelines will continue to come out, helping how we can best do this so that we don't have to go on for the next year or more masking indoors for all of our programs because we don't want to deny access to unvaccinated participants. All right, volunteers. So initially we had no on-site volunteer opportunities. We developed one volunteer-based social calling program to help reduce social isolation and provide continued volunteer opportunities. We opened up virtual volunteer opportunities to interact with patients. Bingo became very popular on Zoom, and we had virtual volunteers that were happy to call bingo. Some of the challenges, of course, maintaining community relationships, these businesses or social groups that typically come in, maybe it's every Saturday to help serve meals or every time we have a party to help keep things going. We want to maintain those relationships, but we weren't able to offer them opportunities on site. So we did, the challenge, of course, also was transitioning volunteers to online and phone-based programs because it's not what they had initially signed up for. Looking at reopening, we have set into place already that only vaccinated volunteers may return to on-site volunteer opportunities. Unvaccinated volunteers may continue to participate in calling or virtual volunteer opportunities. And we do require volunteers to provide a proof of their vaccination, which we keep in a secure site. Challenge, of course, is designing the protocols for on-site volunteer opportunities and how to do that without it seeming as though we are not allowing opportunities for unvaccinated volunteers. All right, location. So initially when this started, and this would have gone through as guidelines came out, we did upgrade our HVAC filters. We purchased individual air purifiers for every workspace. It's more than I could count. Capacity initially reduced participant staff capacity to 25% or less to accommodate for social distancing. So one of our interview rooms was basically turned into just a workspace because you could not accommodate a case manager and a client in there. For check-in, we staffed the front door prior to the reception desk so that anyone that wanted to enter the building got a temperature check, were asked the screening questions about symptoms, asked to use hand sanitizer. Signage, there is a abundance of signs that were provided by the city going throughout this, and they're everywhere in all of the threshold languages, and when we felt necessary, some additional languages that represent the populations that we see. And then we did do marks on the floors, tables, sidewalks. Indoors, there's blue painter tape X's everywhere to mark what 6 feet of distance is. Outdoors, we spray painted footsteps for the line for food so that we could keep people 6 feet apart. And then we assigned staff to supervise traffic flow, maintain capacity limit counts, and manage social distancing among people that came on site. PPE standard, everyone was wearing masks, and if anyone working one-on-one with a client wore face shields. We installed plexiglass barriers just about anywhere that you could be working with a client. Cleaning protocols, any shared equipment, tables, chairs, computers, everything got a wipe down once you were done using it. And then daily, we had 2 scheduled deep daily cleanings. Hand sanitizing, we had sanitizers mounted at every entry and exit way throughout the building so that there was always lots of opportunities to sanitize your hands before or after touching a doorknob. Looking at reopening, our capacity is now at 50% or less to accommodate for social distancing. At the check-in for staff, that's now, they do that at home. Coming to work, they're saying that they have no symptoms and they're safe to work. We still do screening questions for participants as they enter. We don't do temperature checks anymore. Traffic flow is still supervised by staff, making sure that everyone is, they're not grouping up in places, that we don't have too many people on the floor. And while we do still wear masks indoors, we no longer require face shields. And we still do shared equipment cleaning in between, but we're down to only 1 scheduled deep cleaning every day. For the participant experience, some of the challenges, some participants, as I mentioned before, do not feel safe returning on site. Maintaining an online participation option is vital. We have to continue doing that for those clients that either are not comfortable coming back, or, as we've learned, the ones that need to be stuck at home for a while, they still want to participate. Having limited drop-in availability of services, it did help us manage capacity, but it was really a burden on participants who needed assistance. Understanding that not all participants will get vaccinated, and prioritizing implementing equitable program policies so that clients are still able to participate in programs, even if they don't want to get vaccinated. And then engaging participants in their fears, expectations, and concerns to best make informed decisions in reopening. While we could reopen as per the guidelines, if clients say that they're not uncomfortable with something, then we are comfortable slowing down some of the reopening in order to make certain that everyone feels safe to come on site. And a little bit on activities. We continue to update participants by phone or email as programs become available. We collect vaccination data when possible, and this is both so that we know whether or not we can serve a meal at a small group program, but also as public health orders change, I believe that it'll be necessary to have this information. We coordinate transportation as needed with limited public transit availability. The 31 being out of service was particularly hard on some of our communities. Our Lao and Thai clients come from the furthest end of the 31, and so a lot of them have not been able to make it on site to get the assistance they need. Even with fully vaccinated participants, we maintain mask and social distancing policies. And as I said, if required by the program, for instance, they need to be indoors, they're going to be a group, they're going to be eating, we have the option of limiting that to vaccinated clients only, so that we are lowering the risk of exposure. When groups arrive or leave, we accompany them to make sure that they are keeping their mask on as they exit the building, that they're not all stopping and clustering in one area. And when possible, this was a big thing, maintaining participant cohorts to limit exposure and ensure easier contact tracing. So a lot of our groups, because of our population, were separated into language groups. So we had a Vietnamese bingo, a Russian bingo, a Laotian bingo, a Tagalog bingo. But by keeping that so that any small groups coming on site were always the same small groups, it really limited exposure to other individuals. I think that is my last slide. I hope that was a reasonable amount of time. That's it for me. So I think, Francesca, if you're ready.
Hey, Toby, before we get into that, there was a question for you.
Sure.
in terms of volunteers, can volunteers provide a virtual receipt of their vaccination if they do not have the paper copy?
We are willing to take they can do the California state setup. They can take a picture of theirs where they have, as long as it's something that we can verify it is an actual proof of vaccination. We can't really take, oh no, sure, I'm vaccinated. I hope that helps. It takes about 3 minutes to do the state. That gives you the code that can be scanned to verify and has your information. So we're more than happy to use that.
Thank you.
All right, should I take it away, Mike? Okay, I'll share screen. Hold on 1 second. Here's that presentation. Oh, all right, I'll just go this way. Can you guys see my screen? Okay. Hi, everyone. So I will just be representing for Unlock Day Services, our Unlock 30th Street Senior Center, and what our COVID-19 protocols are for resumption of on-site and in-person program services and activities. And I'd like to start by just saying that similar to Toby at Curry House, we also, didn't stop like many of you on the call. Our services and programs shifted very quickly. We, started doing our virtual programming. We were doing to-go meals. We were doing a frozen 5-pack for some folks that weren't able to come out to our sites. We were delivering those. And then all of our ADRC and case management services, they actually didn't stop, and we still allowed those in-person on-site visits and services for those seniors that weren't able to access, on the phone or telehealth. So what I'm going to focus on in this presentation is just what we are doing in our current state to think about this re-entry and this kind of slow rollout and reacclimation to doing things in person. So what we are doing for our people, our employees. So for our employees, we are encouraging staff to get the COVID-19 vaccine. We are also, as an organization, reviewing the current vaccine mandate for staff in a high-risk setting. As the Unlock 30th Street Senior Center, we are attached to a PACE program on the second floor. The PACE program is our program for all-inclusive care for the elderly, and it is a medical clinical center. And so we are reviewing this mandate as a building and looking at as a high-risk setting. We are requiring all staff or all persons really to be with a face covering while they're inside the building, regardless of vaccination status. We are still doing the daily signing in and health screening attestation. And this is mainly for our contact tracing to really just make sure that we have a very fast and efficient way to get in touch with people if there by chance was an exposure on site. We have eased our social distancing requirements for most activities and shared spaces, but like most, we are doing this with caution, and I'll share later on in the presentation what we're thinking about as our slow rollout for activities and services, specifically regarding the social distancing. And we are reacclimating our staff to working in the center and shared office spaces. Really, before we start engaging our senior community, we really understand that this is going to be a slow process, and folks are at different thresholds of their comfortability and where they're at and wanting to re-enter the workplace, and also for our seniors. And so it's really important that we as a community center that we reacclimate our team to just, how do we work again together in a shared space? How do we, be in a meeting together, not virtually, but actually in person? So we know that this is going to take some time. We have been working on getting an electronic room booking system to ease our scheduling. So this is something that we're working with our IT department to attach to our Outlook so that we have a very simple and easy way of booking our room spaces here at 30th Street, so that we are very clear on who is where and what times they'll be there, so that we can, accommodate the cleaning pre and post services. And then we are actually, as an organization, Unlock has been doing these amazing weekly COVID-19 commercials. We do use them for supervisors to use in their staff meetings and also in our daily check-ins. And really, these commercials are just kind of good reminders for us around good hand hygiene, infection control protocols, and procedures. Another thing that we are doing for our staff is we are doing on-site testing for staff who are unvaccinated. That is done weekly, and it is a saliva testing. And then we also have a 30-day supply of PPE and cleaning supplies on hand. So I read everything there from my left column. Over on the right, it gives you just kind of a little bit of, how we're doing some of these things. And so, I can go over some of them, but I know Mike said that we're going to send these out. I think one of the biggest ones is really acknowledging that comfortability level is very personal and individualized. And as we didn't stop services from the very jump of this pandemic, we started this very similar to Toby, an AB kind of cohorting scheduling where folks were coming in a 2-week rotation. And given the Delta variant, we will probably reinstate something very similar to that to again accommodate any staff who are feeling any trepidation around rejoining the work site fully, but also understanding that our services are meant to be done in person and our community needs us. And we have so many seniors that we have not been accessing through our online services and programs. And so our true goal is to get those seniors back in our center and in our care. So moving on to this is what we are doing for our participants. And so we are requiring our participants to do the health screening prior to entry. And so they are doing an attestation and signing in. Again, it's those health screening questions that we're all used to, and this is for our contact tracing. We are requiring everyone to have a mask while they enter in the building. And the way that we're doing that to really ensure that our participants have the correct face covering is we also have a 30-day supply of PPE for all participants as well. So we've really been able to bulk up our PPE inventory. Another thing that we're doing to really maintain and really have control over the flow in the center and who's here is we are requiring pre-registration or appointment-based services only right now. And we are also prioritizing seniors who we have not virtually connected with and with small group and one-on-one services. So those seniors who really are monolingual Spanish-speaking seniors, monolingual Cantonese or Mandarin-speaking seniors, and our seniors who just did not have any technical devices or ability to join us online. We are looking at cohorting our seniors and activities when applicable. This is a really great way to limit, cross-contamination and cross-sharing of aerosol droplets. So we are trying to cohort, and we are trying to do that by block scheduling our activities. And so really focusing on not necessarily quantity of activities, but quantity of seniors able to join those activities. So an example of that would be maybe we have one class, virtually a day, and then we have 2 classes that are offered during, in person, and they're blocked in the one in the morning, one in the afternoon, so that we're reaching more, but with the same content. We are limiting our shared materials and supplies. So we are trying to purchase items for seniors to keep and use and bring back when they use them specifically for our exercise programs. We are committed also to serving our seniors and adults with disabilities regardless of their vaccination status. So we are not requiring our senior participants to disclose vaccination status in order to participate in our programs and services. We have, again, enough PPE on hand for our staff and our participants to safely provide services in the case of someone not being vaccinated. But on that other side, we are encouraging all of our seniors to get vaccinated. We have actually partnered with Kaiser and with Meta fund, and they were able to provide us an opportunity to do vaccinations to our homebound seniors, to our home delivered meal seniors. We were able to either go to their house and get them vaccinated or bring them into one of our PACE centers. So that's been a really great way that we've really gone into community and really encouraged and educated our seniors on how important it is to get the vaccine. And then another way that we are engaging and communicating with our community is we are doing our virtual senior council meetings and town halls. We have newsletters, flyers, emails. We are making these phone calls still on a daily basis, especially to those folks that are not picking up the meals or joining in virtual. We are continuing those calls. Moving on to what are we doing with our volunteers? So we are gauging interest in returning to in-person volunteering, and we have now actually both opportunity for in-person and virtual. We have developed a brand new volunteer program policy and procedure handbook for Unlock 30th Street. So it's very exciting because we've been able to develop infection control policies and procedures to go into that for our volunteers. And so we also are, we're looking at possibly requesting to see proof of vaccination for in-person volunteering. We are working through those logistics through, operations to just really make sure that we have a safe and secure way for staff to verify the vaccination status, maybe during the registration process, instead of having to hold that information, that protected health information on site. We are looking to orient and train all of our volunteers to our COVID-19 infection control protocols and all of the new operations that follow those protocols. And so we will be, again, onboarding and training this volunteer workforce before they come back in. And they are also required to do the health screening and attestation once they're here, and everyone is required to wear a face mask or covering regardless of their vaccination status. And what are we doing with our location, our places? So I think some of you on the call may know that Unlock 30th Street Senior Center, we are the host agency for a lot of the amazing programs and services that DOS funds throughout the city. And so throughout this time, we've not only been creating policies and procedures for our home base here at 30th Street Senior Center, we are also creating policies and procedures for our partner sites and locations, regardless of the size or entity. We really want to make sure that we can serve our seniors in our partner sites. So one thing that I wanted to highlight from this is that we actually do have department-specific infection control protocols that our program managers have developed that really hone in on the specific necessity of their program. But like others, we are also examining and have examined our air quality. Our facilities team was able to upgrade our HVAC system across all of our buildings. So at 30th Street, we definitely have been utilizing our outdoor spaces as much as possible. Our teams are doing surveys of local parks around the area to make sure that there's enough space and it's steady and secure and no slips, trips, falls, or hazards there. We are opening windows and doors when possible and have air filter systems where appropriate. So again, in our high activity, say always active, or any of our exercise programs, we have extra air purifiers in those spaces. Capacity, though the capacity limits have been lifted. As an organization, Unlock has decided to follow those guidelines, and so we have lifted the capacity restrictions. However, we are still considering a lower capacity for higher risk activities. So activities where there would be lots of breathing, lots of activity, we would definitely have a lower capacity in those rooms. Our cleaning protocols, high traffic areas and common surface areas are done by our janitorial team at least twice a day. And then our staff take care of the in-between uses of shared items and their own workstations. And then we have nightly sanitization by our janitorial service. And then we have a weekly deep clean that also happens in all of our spaces. We're very lucky to have an amazing janitorial service that Unlock was able to secure for all of our buildings. They do an amazing job, and we have a great response for any if there was ever a positive case, we've had a great response to that cleaning and sanitization. For our hand hygiene, we definitely have designated hand washing locations and hand sanitizers stations all up around the building, attached to walls and in our most common used areas. For our restrooms, we are posting hand hygiene reminders and making sure that all of our restrooms are stocked with the hot water, soap, paper towels, all the things that are necessary. And again, just those friendly reminders with the signage for both staff and participants that while you're in the building, you must have your face covered, nose, mouth, covering your chin, you know, and to sneeze into your arms, so on and so forth. For our break room and our dining room, we are actually at our strictest social distancing capacity here. We are still maintaining a 6-foot distance while eating without a face mask on. So inside any on-lock building, we are required to have our face mask on. The only time we can take it off is when we're eating or drinking. And so that does transcend into our break rooms and into our dining room. And then for our partner sites, like I mentioned, we have developed infection control policies and procedures for each site-specific activity, and we will be doing site visits and fidelity checks before the launch of any on-site program. And then last but not least, this is a draft reopening timeline for Unlock 30th Street Senior Center. I do want to make a note that this was actually developed pre-Delta variant spike. So the little X's there on the legend, when you see 50% capacity and 100% capacity, you can really interpret that to room capacity, not center capacity. So we're just saying in the individual rooms, what that capacity would be. So we're starting at a 50% and then rolling into a possible 100% capacity for each room. So this just kind of breaks down the 2 quarters that are that are in this calendar year, and really showing a very slow and gradual rollout to again reacclimating our staff and our seniors to doing programs and services in person. Our low impact services and classes I'm defining as our ADRC appointments, case management visits, outdoor activities, workshop classes like our DEEP program or chronic disease self-management program, enrichment classes where you're really just sitting and doing something, or games like art, chess, sewing, things like that. And then very low impact physical activities such as yoga, or we've been able to develop a somatics program here at Unlock 30th Street Senior Center. So that would be one of the programs that we would be able to lead as low impact, or even our fall prevention class. Our medium impact, we're saying in person, is bingo, because man, that can get lively. So that's a little bit more of a medium impact. Our computer lab, again, because of those shared spaces, and then events and celebrations, because those usually come along with food. And we know that food is still one of those areas that we really want to be careful about. And then our high impact activities would be things like our exercise classes, so always active, our indoor congregate dining, and our dances. If anyone has ever been to Unlock 30th Street Senior Center on a Friday, you can hear the music down the street, and it is an amazing dance party with our seniors. We will be examining and experimenting with those really towards the end of Q2, because we really want to see how this Delta variant, what it does for our community and how we can re-engage. Our biggest TBD on here is our congregate meals. Like Mike said, this is different for everyone, and we are a large congregate and home delivered meal contract with DOS, and so we do have several sites that depend on our kitchen to prepare the meals, and we are prepared to start those conversations with our smaller partners to see how with the smaller sites, the partners with the smaller sites, to see with those lower numbers and meals how we can start to engage and re-engage the congregate in person And so we'll be reaching out to our partners, but that's really, it's very site specific because we still do need to maintain that 6 foot of 6 foot distancing with the mask on. And so just making sure that folks have enough space and have the supplies that's needed for that. Until then, we'll continue to do our congregate to go. And I think that's it for my presentation. I'm gonna stop share there. If I can just make a quick plug though, this work was done really in partnership with all of the amazing program managers at Unlock 30th Street Senior Center and the amazing members of CASE. We have been working as a community congregate work group for quite some time now, trying to decipher through all of these public guidelines and restrictions and see how we can interpret them so that it's more of a framework and a playbook for folks to apply to their specific site, because as mentioned, we're all working under different conditions and circumstances, and we all have our different niches as far as the services we provide. And so I'm really excited to say that I think we're actually going to be doing our final design session at the end of this month, which means that some of the slides here that you've seen will be a part of that, and it will be actually a much larger playbook that we will be able to disperse to our community partners. That really is, I think, a really great framework, kind of plug and play on things to consider, because really what this is just a big game of interpretation of what we're supposed to do given the guidelines. And so just wanted to plug that and give a shout out to all the amazing minds that helped put this together.
Thank you, Francesca. We have a couple questions for you. The first one, can you talk more about the Kaiser and Meta partnership and any other partnerships that have happened?
Sure. We're very lucky to have Meta Fund as one of our philanthropic partners, and they support our work. And so we were able to receive some extra funding from them to do a homebound effort to reach our homebound seniors. So to really, it was a very collaborative effort between Meta, Kaiser, and Unlock PACE. It was our medical clinical, and then our Unlock 30th Street Senior Center. So it was kind of this quad partnership that has been, actually, I think we are in our 4th round of reaching seniors who are either in our home delivered meal program or just any of our community partners. If they have said, hey, we have someone that is homebound and they need a vaccine, we've been able to connect with them and then get that scheduled and get that to happen. Earlier on, when Moscone was doing the big push, we were also getting seniors who were able to leave their home. We were able to get them to Moscone through this same effort. And that was actually through Lyft was able to provide us with some vouchers as well to get the seniors over to Moscone.
Thank you. There's another question. What are your plans for managing an outbreak if one does occur?
I'm so glad you asked that. So I'm very, very fortunate as a part of Unlock. We are a medical clinical health organization. And so we do have an amazing team, an infection control team, and an amazing compliance and legal and regulatory affairs team. And so they, in partnership with our operations team, we've put together the Cal OSHA mitigation plan, which very clearly describes what we do in case of an outbreak. What that includes our infection control, our contact tracing, our isolation, and our communication, and then what we've been able to do. Luckily, as Unlock 30th Street, we actually haven't had any major disruptions or major outbreaks to disrupt our service. If there was ever a case, it was a quick 24-hour clean and turnaround with the sanitization. But we definitely have, through the mitigation plan, we have our pieces in a row.
Thank you. I think that's it for Francesca specific questions.
Yeah, Sarah, I think we'll, why don't we go through some of the others quickly, and
Okay.
then we'll bring in the folks here in case some of the questions are a little bit more broad. I'll hit the first one really quick. Given city policy requiring vaccination for workers, what are thoughts on the part of DOS about requiring vaccination from community participants or not? And I think, so we're getting pretty close to that line, right? So we're requiring it of our own DOS staff. The city has issued a joint statement with multiple Bay Area counties saying that they are urging employers to require vaccination for workers. The department is supportive of any contractor who would like to implement vaccination requirements for their staff. We have seen it with the two providers here. We are very much in support of that. We will help them as we can to implement that. That doesn't quite, so we're up to that line. So what will it be when we cross that line? And that will either be in the form of the city doing a citywide requirement for contractors. That has not occurred yet, but could happen. I don't have a feel for where that is. The other one, I think the other sort of question in there is, can DOS act independently of the larger city and require it for its contractors? I actually don't know the answer to that, and that is something that we are going to have to figure out if we can even potentially act independently as a department before we take that step. So that's the best I can do with that one. If offering in-person services and activities, should staff be tested in case of symptom-free breakthrough through infection? If so, how and where? And I think that actually was alluded to in some of the presentations. I think, and now it escapes me. If anyone wants to jump in, I think staff, our vaccination is the best way to do things. I think vaccination of staff is required. I think some of the providers who are not required, if vaccination has not been completed, then regular testing is required. And there's also screening of staff on a daily basis. There's
I can jump in on that
Okay,
too,
go for it,
Mike.
Pat.
So at Catholic Charities, we highly encourage all of our staff to get vaccinated, and we have rules. If you're not vaccinated, you have to go and get tested at least weekly. If you're vaccinated, we're still asking all staff to get tested monthly because, again, there are those variances out there, and you still need to stay on top of whether somebody is contagious or not, or a carrier. A lot of people have had COVID and have been asymptomatic, and so we don't want to be spreading it because we're not testing. So testing is still a very important part of this.
There's one about checking the legitimacy of vaccination status of community participants. So this would be clients. Does anyone want to speak to how you guys are doing that?
Well, sure. I mean, we're honestly taking a copy of their card, or if they've signed up for the state, I don't want to call it vaccine passport, but with the QR code, we're not taking anyone's just word for it. We're actually getting a copy of the documents.
That is the same internally with the city. We have an online portal where you can submit a copy of a vaccination card, link to the state thing or some sort of viable medical document. Okay. Let's see. I want to get to the one. There's one about how is it ethical to reopen in-person services at full capacity to seniors and immune compromised people right now. And I think that what we are doing here is, first off, I think perhaps an unethical example would be June 15th requiring everyone's doors to be open and everything to be fully open. And that is what we are not doing here. And what we're doing here today and talking about is the idea of collaboration between the department and community providers, using a mix of the best information and guidance, scientific information and guidance that we have, combined with making sure that we are accounting for the comfort level and safety of our clients. I think that that is how we will strike this balance and move forward in that way. I think it also is one that perhaps we're not talking about here is, there is a very high vaccination rate amongst older adults in the city, and allowing them also to have some, as we account for their comfort level, thinking about their personal choice and their comfort level and their interest and need to be back out in the community receiving services instead of really kind of shuttered at home, which is really what it felt like in the initial days of this pandemic. Okay. Let's see. Well, now the questions are really stacking up. This one is pretty old, so I want to get at it. Because of the Delta variant, what do you think is the real possibility of another shutdown? I think none of us have access to the information, either scientific or political, to predict something like that. I think the theme for today is that we feel comfortable that we are on a path towards reopening and need to be thinking that way, with building in some flexibility to understand and account for changing requirements along the way. Okay, there are more, and why don't we get to those in just a minute, because I do want to make sure that we have time to bring Patty in sort of as our next phase of this, to talk kind of as a representative case and just as a knowledgeable community leader in services about what we're talking about. I have some prompts that I can use to get us started. Patty, what do you think are some of the biggest challenges to reopen?
Well, I know for us, and because we did stay open like in some of the other programs throughout the pandemic, and we opened our adult day program in May. And a lot of it is just education. When somebody had said, how is it ethical? Well, we have every family and or caregiver or senior sign a release. And it's basically a statement letting them know that there's still a pandemic going on. There are risks in socializing with other people. And so it's kind of an educational tool we use to give them the tools to know what could happen if you're out there mixing and stuff, and then making sure they understand the risks of getting out into the community and connecting again with people, because we're not past the pandemic yet. We are still very much within a pandemic state, and people need to understand the risks of interacting with people. Masking is a huge issue because a lot of people, there's so many mixed messages out there saying, but this, the county says we don't have to mask and you're saying we do. And so I think being really clear about what your protocols are and what your guidelines are is really crucial, because it doesn't really matter what the restaurant down the street is doing or the grocery store. It's what is you as your agency and what are your protocols that you're investing and stating have to be followed. If you're consistent with that and every staff member is consistent, then the people who come to your agency will understand that that's the protocols at this location. They don't have to come to your location if they don't like your protocols. They can go look for something else. But I think consistency is really important. And then ongoing testing is another big issue for people. A lot of community members felt that since the pandemic was slowing down, that there wasn't really a need for testing. But the way we're catching all of these variances and we're keeping the pandemic in check, so to speak, is by people continuing to be tested. And I can speak, I have no problem telling people I got COVID last fall. I was asymptomatic. You would have never known I was sick. But by getting tested regularly, we discovered very quickly that I had gotten it. And, so it helped me not spread it to other people. So that's a really important thing. And I think one of the challenges we are going to come up with as we reopen is something Francesca related to, in that doing virtual and in-person activities both. We want to continue virtual while we reopen, but it really takes a lot of planning as to how does that happen? Because it's time intensive and it's space use also. You can't do a virtual activity if there's a big activity going on in the big room. So it's planning, how does that all work and how does it interconnect and how you're able to do it? Because we do want to keep things going for those who can or don't feel comfortable coming in yet. And then for those who want to come in. And I think that's going to be that balance act. And what I've said from the beginning with this is our world has forever changed. People say, I want to go back to normal. I just want to go back the way we used to be. We will never go back to what we did before the pandemic ever again. It will always be slightly different. And if we embrace change in a positive way, I think that'll really help. So those are some of the biggest challenges I see coming forward.
Anything else that folks would like to add on that? Let's talk about some of the best practices or actions we've seen in reopening. I think I have to highlight, Toby mentions it often, that they never really closed. They were just a moving, shifting provider who kept, changing from Toby, from day to day, from week to week, how you.
Well, I think I mentioned this with you earlier this week. Like, there's a chance that we could be getting another public health order coming out right now while we're here on this.
That's great. I should open my email. Yeah.
And I don't think that any of us were really prepared to turn on a dime and just be able to change everything that we do. But I do think that there were some really valuable lessons. Most of us have known that the digital divide is a problem. It's working with older adults and online services. It's been a big problem for a while, but what I don't think that I had necessarily considered was how big of a problem that in the case of a pandemic, which I didn't think I was ever going to live through, we would have older adults that no longer had access to any of their services because they needed to stay home and they didn't have internet, or they didn't have a device to log on to the internet. They didn't know how. They don't understand the importance of being able to, meet with their doctor via a tablet or a video chat. And so I think that that's something that we all need to hold on to wherever this goes next, whatever the next steps are, is that we really need to address the digital divide and make certain that all of the older adults are capable and able and feel comfortable with accessing things online should anything like this happen. It's not just a pandemic. This is, you break your leg and you got to stay in bed for 6 weeks. You need to be able to continue to connect with your peers and with professionals and, adjust the services that you do receive so that your situation does not get worse.
Toby, follow up for you and maybe the group in general. Do you have any thoughts on, you guys have been one of many models of flexibility and through the changing times. How do you keep that how do you keep staff engaged with that and buy-in and keeping going along with all the changes? It seems it can feel overwhelming.
Well, there were a lot of conversations with this, and Case had started a group to talk specifically about supporting staff during the pandemic. And, at first, I came from working at universities prior to coming to Curry. And so I did what I was familiar with, and that was throw food at the problem. And so we were serving hot meals beyond what was probably fiscally responsible. But if we had people continuing to come on site in a pandemic into a neighborhood that was not, well masked and incredibly safe, really, during a part of, well, still, we needed to make them or help them have reasons that that day wasn't the worst day and every day didn't continue to be the worst day. We did care packages home to staff. We have listened to staff and engaged them in this entire process. We do have staff that didn't make it because they were not comfortable working during a pandemic. And, I support that. Everyone has to make their own personal decisions with their life and how much working at Curry, can impact every other part of their life. I think giving them a voice at the table was hugely important, and being able to provide sort of a model for ourselves in the best way that, if I stopped coming to work, then I couldn't ask my staff to come to work. If I wasn't going home and making wellness calls to clients, then how do I ask my staff to do the same thing? So honestly, I think that we just roughed through this as a family. All of our closest contacts became the people we worked with because we were isolating from all of our friends and family members. So it was a group effort, and I think that that's how we'll keep doing it. We just continue to keep every part of the agency involved in navigating the process.
Yeah, Mike, I would just echo with what Toby's saying, and just clear and consistent communication at all levels with our employees, and listening to our employees. They had great ideas moving forward, and after our initial pivots, and how could we enhance care, and they just came up with really valuable activities, but also innovative activities, and they just stuck through it throughout the pandemic. And I just think allowing that, just having, not allowing rather, but having that level of communication and level of transparency really really allowed our employees to really buy into the process. And it was a process that was unmapped. It was really a process that was created by all of our staff, and once we were able to do that, it just became a living, breathing thing in and of itself. And I think we're still in that process. As Patty said, the pandemic's not over. We're going to have to shift again at some point, I believe. And as long as we keep our employees and our participants engaged in that process, we'll be able to serve the needs that are there in front of us.
Yeah, just to add on one tidbit, for us at 30th Street, it not only engaging with our staff on every step of the way, but being okay with saying, I don't know, when I don't know, and really being honest about, y'all, things are changing, and it's changing really quickly, and I'm going to get what I can. And, so just really, I think during this pandemic, an approach that has worked for us has been a very honest and transparent approach, bringing our staff along the way to every turn and twist and every hurdle, and really setting kind of the guidelines around, like, hey, this is what, these are the parameters, and then allowing them to come up with that process. And like Dan said, like, some of the most innovative and creative things came out of our staff just wanting to serve our community, and really finding ways and spending hours and hours with seniors, some of our monolingual Spanish speaking seniors, getting them acclimated to just using a phone that's not a flip phone, and then getting them into the digital, crossing that digital divide has been, amazing. And when we say hours, I think we did some data research. It's like on average 6 hours just to get one person up to speed on just how to navigate, just turn it on, turn it off. This is, what the screen looks, this is the function. So really just engaging our staff, and food is a big one, making sure that food is available, and that if they are here, that we're taking care of them. And one thing that Unlock did also that was really great is we have some chaplains that are on staff, and they started this midday meditation on a daily basis, and it's plugged into everyone's calendar, and you just join when you can. And it's an amazing, just, guided 15 minutes of just some self-care to decompress and regroup and reground, because this work is hard and we all acknowledge that.
I have on my notes, transportation. We know this is going to be a challenge. I think the best summary I can provide is that transportation providers are working on catching up to capacity and sort of restarting. And And that's going to be critical to getting people linked to services and to the centers. It's something that the department is aware of, and will be factored into how this reopening goes.
And Mike, on that too, I think it's important that everyone realizes that that's going to be true for staff. People that have been working from home, if their bus line's gone, when this first started, my bus line went out almost immediately, and we had to take to driving to work. So it is something beyond just participants. You'll have to really be able to be flexible with your staff coming back on in case their bus also isn't running.
Noting childcare as well. I think my understanding is that, for a September 1st opening, really childcare would have needed to been planned, last April or so, or something like that. So,
and I will say one of the few small joys of this pandemic is that we have had children on site with their parents working throughout this. And, if you're working in a pandemic, to have, an 8-year-old run down the hallway to ask mom to help her get online for class, it's totally worth it. So if you have the opportunity to make that an option for parents, it does make, moving back on site a little bit easier.
I think that goes to like some of the accommodations and things you have to look at. This pandemic hit all of us. It didn't just hit our clients, it hit us as people too. And so people are used to staying at home and working. There's talk about how challenging it is for someone who's worked from home for the last year and a half to now re-enter into community and feel comfortable with that and feel that this is normal. And so those are things, flexibility is going to be really that key word, and really talking it through with your agency people, because, unfortunately, there's no playbook to work from per se, and every agency is going to have their own specific requirements that they want to follow as an agency. Then you have to, and that's like the trickle down. You've got the federal, state, the community, the county, the Department of Public Health guidelines. Everybody has guidelines, and then you've got your agency guidelines, and somewhere in there, you will find out what works for your program. And just be kind to each other and move slow. It's not going to happen overnight.
That's been the biggest message that we've been saying, Patty, just to echo that when the pandemic hit, when we all had to shift and pivot our activities and services, it was almost overnight that we did this pivot and shift. And we were like, okay, this is how we're doing it. And then creating that normalcy, right? Like it only takes 3 weeks to create a routine or habit. So we've been in this for 1.5 years, right? A better or worse part of 1.5 years. So that that realization of that is huge, that this is not, even though it was a quick light switch off, it's not a light switch back on, because we've all been so used to working under these conditions and working from home or in a hybrid model. So I think really being compassionate and listening to our staff and really listening to ourselves, because I'm glad you said that, Patty. This affected us too. Like not just we're a part of our community, as well. And it really did, I think, affect all of us in different ways. And so just being really, really clear that we're not expecting an overnight shift. This has to be a slow, gradual roll out that can still be flexible and nimble to go back in the case of any type of, reinstating of any of the shutdown or restrictions, right? And just having that flexibility of going back and forth.
Looking at some of the Q&A, there's one on religious and cultural exemptions to particularly vaccination. I think as a starting point, the local health order, the San Francisco Department of Health one, does talk about this. I think it includes a sample form for medical exemptions. I don't believe it's specific as to religious exemptions at this point. Do you guys want to talk about your experiences at your agencies with decision making around that and how and if you've made a decision on those?
We're waiting to follow when the city inputs it on insofar as which health conditions qualify someone and what sort of proof of religious exemption will be required. So it is a conversation that we consistently have, but we are first going to take, the final word of the city when the vaccine receives approval, and then we'll make the decision whether we want to go more restrictive than what they put into place. We won't go less restrictive.
Unlock, we are having those conversations as well. Clearly, because we do have multiple areas of service within the aging community. And so we are taking a very thorough look at what the implications would be to a mandate and what that would look like to our workforce, and where it shows up in our workforce around who is and who isn't. And really taking a very, again, individualized and compassionate approach, and really trying to first see what are the barriers, what are the reasons, is there anything we can do as an organization to help educate and or remove any of the barriers that may be existing, and then really then approaching those that may be under the medical or religious exemption, also through a very compassionate lens, and making sure that our HR team is really leading that. And I do believe that there have been talks that there would not be, I think, Toby, to your point, that there is a form for the medical, there isn't necessarily anything there for the religious. And so being very delicate and very sensitive to these, because it's a sensitive topic.
There's a question in the Q&A, just paraphrasing, because I don't have it in front of me right now, about agencies that are working through their own plans. Can they should they just follow Onlock and Curry, or what should they do? And I think I'll start by saying that each agency is able to, this is at the agency level, as there are so many unique ins and outs. Curry and Onlock are presented here today as examples. They are ones that DOS thinks are well thought out and good examples to be shared. I think adopting theirs, I think that may be an agency decision. I think Toby and Francesca certainly would be willing to be a resource if you wanted to get in touch with them. Is it fair for me to volunteer some of the work, to talk about some of the work that Case has been doing on this?
Mike, I can try to address that. I think we've all realized early on in the pandemic that none of us could do this by ourselves, and not really. And we all have to think about our agencies first and what we are able to do, what our limitations are, and what some of the barriers that were in front of us. But early on, Case started discussion groups, and we had 3 cohorts of discussion groups to try to manage and talk about what we would be able to do as organizations to help each other out, and how do we look for solutions for the problems that were in front of us. So there are a couple of congregate site discussion groups. There's a disability and adult day healthcare discussion group. And so out of those groups, actually this presentation in and of itself was born out of those groups. And those groups lasted for a good 6 months, and I think a couple are continuing with that. So I think the realization that Case had early on was, let's tackle this together, and let's have a system that allows us to be able to communicate with one another, create change, and then really talk about that change. There's another piece of this that Case is embarking on now, where we have a case study writing project that we will profile 5 agencies and what their pivots were, so we can actually promote what those agencies have done throughout the pandemic. So I think, you know, Case's role in this has been a way to help one another out, those that are part of the membership. But not only just that, but also in our partnership with DOS and even with our state partners, that we are able to influence policy and create new systems of care. I mean, we are talking about we cannot let our foot off the gas with trying to bridge the digital divide. And that's something that should be allowed moving forward in certain circumstances, and how that helps us engage with participants we wouldn't be able to who weren't able to participate even pre-pandemic. So there are a lot of lessons learned here that we can continue on with. And I think first and foremost, this was a community effort. And I think as Case memberships, along with our partnership with DOS, we're really proud of that.
Getting to this kind of more specifics to that question, Francesca alluded to this kind of design playbook that one of our congregate discussion groups has started to create and have almost gotten finalized. So that's going to be kind of a more general, sort of non-specific kind of outline of things you can do and kind of tips that's going to be formatted similar to what you saw today from both Francesca and Toby, but kind of more non-specific. So those might be some helpful guidelines that you can use. And thank you for Francesca and our consultant that helped us with that. That should be released just as soon as Francesca and her group can review that draft. So be on the lookout for that.
And how will people know when that is out? Be a Case member, get in touch with Case.
Both
Yes.
that, and we can also get in touch with Case. We'll send it out, and we can also share it with DOS.
Okay.
And they can
In addition to what Fiona was saying, and our community services group is still ongoing. We meet on a regular basis, and if anybody who's here wants to participate, they can reach out to myself, Francesca. She sits on that too, and just let us know that you want to be on that group, or even let Fiona know, because it's open to our Case members, and we want to continue this conversation because this isn't over. Things are going to change, and as we roll into the winter months and flu season comes upon us, and how that's going to affect us. And I think it's nice to know that there's other people dealing with the same challenges you are, and to be able to have that open conversation, and lots of great ideas come from everybody. You know, there's not one magic person out there. It's everybody as a group. We're all in this together, as they say.
Taking a look at time, I guess we sort of run long, melded this last part into our community discussion, but I do want, people are using the Q&A, and I'm kind of pulling out of there to feed this discussion. But if there are people who I think would like to add anything, I think I would encourage the Q&A or the chat, and we can see about that. So I will let you go and do that process. But in the meanwhile, an additional question to the group is, where is, if you had to pick one pain point where there really needs to be more guidance or support, if you had to pick one, do you know where that is right now? Patty has left the room. She's back. Okay.
Patty had to close the window.
Toby alluded to, the religious and medical exemption information only goes so far right now. What other kinds of things are out there?
I think Jessica on the Q&A alluded to something that Lehman, I think I just said that, yes, Lehman alluded to something in the Q&A that is something here at Unlock 30th that we've really been taking a very good look at and thorough look is the racial discrimination or any type of discrimination that could come out of any decisions that are made. And so one of the things that we've thought about for our center specifically is to really engage our community. It is one thing to engage our staff on policies and procedures, but we have to engage our community as well to really see where that lands with them, and to then also gauge, again, what are the barriers, what is it that, Unlock could do to help remove some of those, or, whether it's education or resources. But the racial discrimination piece, especially around the mandating of vaccinations, has been something that we've been talking about even before the vaccinations came out, because we've been kind of in the crystal ball of things, kind of alluded, we knew that this was coming down the pike. So we don't have a magic answer to it. I just know that we're being very careful and considerate and very thorough in engaging our community to see where that could be shaken up and what we could do to help break it down.
Okay. Let's see. Yeah, we're very close to time, so why don't we, if people can stick around, we'll stick around, but I do want to just quickly close by thanking all the panelists who are here today and who helped with this process. I think that even before COVID, you guys were known leaders in the community. And I think the fact that you have not wilted amidst a global pandemic is perhaps a tremendous testament to each of your character. I think there are many more than just us here. It's not the 7 of us or whatever that solved this. There are many involved. So I want to acknowledge, the 100+ people who were in participation with this event, and those that didn't, who all had to be part of this massive effort over the last, what are we at, 18 months at this point? So yeah. Closing thoughts.
I'll just say, again, make sure, obviously it's important that we get service access to our participants, but I think it's really important that staff are considered as well, because like Patty said, we all went through this too. And so as you look at the best way to reopen your agency, talk to them. Don't get mad if they're not comfortable yet and they need a little help, walking through the process.
And I would encourage anybody who, wants to continue this conversation. I mean, there's so much that is going on in our community. It's really hard to imagine you would know everything that's happening. There's a ton of things out there. And so joining in our group that meets, twice a month, I think would be helpful, because we're sharing ideas, we're sharing resources. Don't feel bad about reaching out. Reach out and be part of the conversation. It really does help keep you in that more positive mode, because I know one comment was, how do you stay positive with all this? And it's like, we've all had our moments. I know I have. It's like, oh, good Lord. But with team effort, it's how you get through it. And the team is Case. Case is one of my teams. So reach out.
Okay. Maybe we'll end early. People can go. Thank you, everyone. Yeah, let's close this thing down. Oh, I've got a contact slide here at the end. Maybe I can share that one really quickly. And Fiona had put the case. Let's see here. Maybe I shouldn't be highlighting my poor technical skills on the way out of this event. Yeah, I shouldn't forget it. Okay. Way to end on a bummer. Anyways, Fiona, do you want to read off? What was that email? It was casesf@gmail.com.
CaseSanFrancisco@gmail.com. Spell out the
Right.
San Francisco.
Okay. It was ending so well. Way to end on a bummer. It's not the chat's beating me up. All right, well, thank you. I'm going to try to pull this back together and just say this was a very fun event. I think that we, in some ways, got a hold of the energy that we had in conversation and thinking. Yes, it is Zoom's fault. I do blame Zoom, Microsoft, PowerPoint, and all of that. Thank you, everyone. Thank you so much. Appreciate everyone. People should know how to get a hold of me if they don't. Michael.Zog at sfgov.org. You can reach out to me, your program analysts, really anyone in the department is here to help, as well as the panelists here can put you in touch with the right person with whatever you need. So thank you, and we'll end there.
Thanks, Mike.
Ready?
Thanks, everyone.
Thank you, guys.